Hello, I'm Lucas, and along with my colleagues Nora, Lawrence, Lindsay, and Ahmad at the Wayne State College of Nursing, we researched, does exclusive breastfeeding versus formula feeding have an effect on infancy growth percentiles? Some background. There has been strong debate regarding the optimal duration and effects of exclusive breastfeeding on infancy growth. The WHO recommends 4 to 6 months of exclusive breastfeeding. Meanwhile, the United Nations Children Fund, or UNICEF, recommends 6 months of exclusive breastfeeding. These debates between such prestigious organizations has led to controversy when providing adequate nutrition to infants. Additionally, recent studies in North America and Europe have shown a decreased rate of infancy growth from prolonged breastfeeding in the third to 12th month of life. Additionally, in developing countries, infants following WHO and CDC feeding guidelines are showing a decline in growth after three months. These findings show current feeding recommendations by the WHO are resulting in decreased growth, indicating that there may be a specific time to discontinue exclusive breastfeeding and implement supplemental nutrition. This research topic is important because if an infant's growth is related to diet, nurses and other healthcare professionals should be educated on accurate information when educating mothers. This leads us to our PCOT question. In newborns, how does breastfeeding compare to formula or supplemental nutrition in affecting infancy growth percentiles within the first 12 months of life? This is relevant because it is a commonly asked question and concern from others. It is essential for us as healthcare professionals to understand, as recent studies have shown a decline in infancy growth, but by obtaining more information, it will assist us in finding the true effects of exclusive breastfeeding versus formula feeding on infancy growth percentiles.
The purpose of this study was to compare breastfed infants and formula-fed infants in the first year of life. This was a way to determine if infant development increased by human milk or formula milk. It is believed that strictly breastfed babies are well developed, but it is also believed that there is not a difference between the two feeding methods. The studies use different techniques to vet the infants and the infant's parents, or the infant's parents. They interviewed the parents to make sure that they're staying with the guidelines of the studies. They have trained personnel to collect the data and the measurements to decrease variables. They have standards that keeps the study pure. Choosing the study participants through stratified cluster sampling or randomized selection. Using our PICO specific terms, we use PICO specific terms to search for our studies. We use terms such as breastfeeding, breast milk, growth percentile, formula, neonate, and 12 months. We also utilize the university online library to obtain research articles on the database of CINHAL or CINHAL, Medline, and Google Scholar. We utilize the university online library so that we can get rid of any bad data, and then we use we search for stuff within the last 20 years.
So for our sampling, initially we identified 7 articles from over 300 that would help us answer a PICO question. So utilizing our inclusion criteria, like Lawrence had mentioned, using terms and keywords such as breastfeeding, formula, and growth percentile in studies that were completed in the past 20 years, 5 of the 7 articles were kept. Each article provided evidence from cluster randomized trials. For our synthesis of research findings, the purpose was to measure the effectiveness of breast milk versus formula feeding infants and the effects on outcome of growth percentile. Our settings include the Republic of Belarus for 2, rural Italy, and America. For our samples, it kind of varied between each study. For Augustoni, the sample included infants that were required age between completed 37th and 42nd week, a birth weight between 2,500 and 5,000 grams, an APGAR score higher than 7 at 5 minutes, and an absence of disease. For the Kramer studies, the samples included healthy breastfed full-term newborns weighing equal or greater than 2,500 grams at birth. For the study by Bell, the samples included healthy singleton infants born at a gestational age of greater than 35 weeks. The infants were aged less than 6 weeks at enrollment, and the mothers were planning to exclusively breastfeed or exclusively formula feed for 6 months. For the study by Zong, the sample included singleton infants with a gestational age at birth that was greater than 37 weeks, a birth weight greater than 2,500 grams, and they had no congenital disease. Our study design for all 5 of our studies was a cluster randomized control study.
Our findings concluded that breastfeeding or formula within the first 12 months of life showed no difference in infancy growth. Differences between breastfed and formula-fed infants was short-term, having the breastfed infants grow at a slightly faster rate for the first 3 to 6 months. After the period of 3 to 6 months, formula-fed infants would have equaled the amount of growth of breastfed infants. The opposite of growth change happened in the period of 7 to 12 months, where formula-fed infants had a higher growth rate than breastfed infants. Infants who are born on the lower than average weight scale are fed formula for the first 12 months of life. Breastfeeding low-weight infants was to boost their antibodies to strengthen their immune systems to fight any present or future infections, and to protect the infant's GI and respiratory systems, while the formula was to boost the weight of the infant. As my colleague Lucas mentioned in the beginning of the presentation, there are different organizations that are debating on the recommended number of months infants are supposed to be breastfed, each claiming that their recommended duration of months is what infants need to continue normal growth. This graph presents that there isn't really a dramatic change in infancy growth between formula-fed and breastfed infants within the first 12 months of life. However, as you see, infants that are born on the lower weight scale are given formula for the first couple months of life.
Okay, so does this study answer our question? Again, our question was, in newborns, how does breastfeeding compare to formula or supplemental nutrition in affecting infancy growth percentile within the first 12 months? Based on our research, there is no evidence of a relationship between formula feeding and growth rate in the first 12 months of life. Article 1 shows that breastfed infants show a progressive decline in growth rate when they had initially been growing faster within the first 6 months, and formula-fed infants seem to have a continuous growth rate within the 12 months. Article 2 shows a significant difference between Article 2 shows no significant difference was observed in either length for growth for age or weight for length. Article 3 showed that formula-fed infants gained more lean mass than breastfed infants, and Article 4 showed that formula-fed infants were a little bit longer than breastfed infants. Article 5 shows that although there were some differences throughout the 12 months, there were no noticeable difference by the end of the year. All these findings show that there is no significant difference in growth patterns in the first year of life between breastfed infants and formula-fed infants. These findings do not strengthen the evidence supporting formula-fed infants growing faster. Breastfed infants had initial growth in the first 6 months of life, but quickly slowed down and caught up to the formula-fed infants by the end of the year. This does not give reason to advise patients on which feeding type is preferred. However, most of the evidence was found from 20 years ago or within the last 20 years. New types of formula have been established and introduced to the market. More recent studies may be needed to determine growth factors with upgraded formula options and could show infants' overall health and future effects on growth rate. Some limitations in our studies include that measurements were not standardized among study sites and probably led to increased error in measuring weight, length, and head circumference. Cultural factors affecting infant feeding in Belarus may differ from other developed countries, particularly those in the West, and may limit the generalization of our findings. And classifying feeding patterns based on breastfeeding intake status without considering complementary foods introduction. Here are our references from our studies. We've also included our summary grid table for our articles as a handout on Canvas. Please feel free to read through the findings and reach out to any one of us if you have any questions or comments. Thank you.